Thank you. So I'm going to be talking about innovation in the pharmaceutical industry. And this presentation has two main parts. I'm first going to give you some background information on the pharmaceutical industry and on UCB, because it's a very unique kind of industry. And then I will explain how we innovate at UCB, and especially how we deliver innovation for the patients. So, as I said, the pharmaceutical industry is very unique and it heavily relies on industry. Just a few facts. The market value is about 650 billion euros. It's a highly innovative industry. Just to give you an example, in the US last year, pharmaceutical companies spent $65 billion just in R&D. But it's also a very challenging industry. It takes approximately between 10 to 15 years to develop a drug, and also millions of euros or millions of dollars. And only one in approximately 10,000 potential drugs makes it to the market. So this is just to give you an idea of how difficult it is to bring a drug to the market. It's also a very highly regulated industry. Every process that we have is regulated and can be audited by the authorities. But in addition to all this, the environment is getting more and more difficult. The public perception of the pharma industry is very low. The payers, so those who reimburse the drugs, are putting more and more pressure on our margins. But most importantly, the R&D productivity is at an all-time low. If you look at the graph, you can see the blue bars. They represent the level of investment in R&D over the years. And this level of investment keeps increasing, while the number of drugs that are approved every year has been decreasing for more than 10 years. Another challenge, which is actually more of an opportunity, is the changing position of the patients. For many years, the patients have been kept outside of the process. They were just talking to the doctors and listening to the advice of the doctors. Now, things have changed. Patients are really at the heart of all transactions. And patients are really very much involved in the management of their treatment in order to get the best possible outcomes. And this is really a big change for the pharma industry. Let me give you more detail about what I mean with patients. Today, they no longer take things for granted. They no longer blindly believe what the physicians tell them. They are more educated, they go on the web, they are looking for more information, they are organized in advocacy groups, and they are very well connected to each other. So this was just an introduction to give you some background information on the industry and on the patients. So let me now tell you more about my company. UCB was founded in 1928 in Belgium. We have approximately 8,000 employees. The company was founded by a gentleman called Emmanuel Janssen. And the main shareholders today is still the Janssen family. So we have a very, very stable shareholder base. We operate in more than 40 countries. And most importantly, we are spending more than 20% of R&D, of our sales, in R&D. Two major milestones. In 2004, we acquired a British company called Celtec, and in 2006, a German company, Schwarz Pharma, in order to strengthen our drug portfolio. Our vision is to be the patient-centric global biopharmaceutical leader, transforming the lives of patients with severe diseases. This vision is genuinely heartfelt because it's coming directly from the CEO, who's very passionate about it. We believe it helps us differentiate from other companies. It's very motivational for the staff. It's compelling, and we believe it's important in attracting new people in the company. It's also catalytic because when you have such a vision, it brings a sense of urgency. It brings a sense of getting things done. And it's also common ground with partners and payers. Today, most pharmaceutical companies tend to focus on one or two therapeutic areas. And at UCB, we focus on two: central nervous system and immunology. So in central nervous system, we concentrate on epilepsy, Parkinson's disease, and restless leg syndromes. And immunology, we focus on Crohn's disease. So for those who don't know, Crohn's disease, it's an inflammatory disease of the gastrointestinal tract. We focus on rheumatoid arthritis. This is also an inflammatory disease which attacks the joints, especially the joints of the hands. Bone loss disorder and lupus. Lupus is a disease of the immune system. Some key financial data about UCB. Our revenue in 2009 was 3.1 billion euros. Net profit exceeded 500 millions. We have a good split of sales by geographic region, with Europe leading, followed by North America, and then Asia, and also quite a good split in terms of drug sales, with central nervous system 41%, followed by immunology and allergy. Now, let's start talking about innovation. At UCB, we are still delivering innovation through traditional R&D. And in our case, traditional R&D is a combination of chemistry and biology, because we also produce biological drugs with antibody. But this is still an old way of delivering innovation. And really the biggest difference we can make here is how much we invest in R&D. UCB is very committed to R&D. We are one of the biggest investors in R&D in Europe, with more than 24% of sales spent in R&D. More recently, we have started outsourcing innovation. So we are now collaborating with several universities. We're collaborating with other pharmaceutical companies like Pfizer, like Amgen, like Wilex. Wilex is an important example because we've outsourced our complete oncology portfolio to Wilex. So thanks to this partnership, we are really able to multiply our capacity to innovate. And this is the latest level of innovation at UCB. It's basically when you start engaging with your customers, with the patients. It's something you've all been doing for a very long time, listening to your customers, engaging with them, but this is really new for us and for the whole pharmaceutical industry. So we now actively listen to the patients, we engage with them, we involve them, we literally put them at the heart of everything that we do, and at UCB we call this patient centricity. And the rest of my presentation will be focusing on patient centricity. So how we deliver innovation actually through the patients. Everything we do in the company really starts with these simple questions. How will this make a difference to the lives of people with severe diseases? This is just a slight deviation to show you that how complex the patient journey is. It's not just about being ill, seeing a doctor, taking a drug, and feeling better. The patient journey is much more complex, and we, as a pharma company, we need to understand every step of the process in order to understand the disease better, and then be able to provide better drugs, but also better solutions for the patients.